Hi, so I'm back. I already did this video one time and I decided to delete it because I got really emotional. It's been a while since I've been back through these records, my medical health records, and yeah, it's alarming what's going on and how these people are conducting themselves in their culture of things, in their medical fields under one umbrella. So I'm going to start with my medical health records. Yeah, and my apologies for if you see any bleeding on me. It's my life. It's my life. I'm doing okay right now. I mean, I have a lot of it covered. It's deep in my neck. I've been in a lot of pain lately. I'm angry as hell. I'm angry as hell because I am tormented on the daily. I posted on X earlier a picture of my legs. This thing's wrapped around my legs. It's been 10 years I've been infected with this. So I'm about to show you some other stuff that may give you a better understanding as to what brought me to this moment. So let's start with the best. This is okay, so this was Miss Baxter, Jennifer Baxter. I no longer call them doctors because I don't think they deserve that respect. All right, so have a look at that, please. Notice uppercase, no further investigations, no further anti-parasitic treatments unless diagnosis identified. And you can see the date on there. Yo, yo, yo. Sorry for the noise. It's really windy out there. What am I looking at here? Yep, so that was June. And so in June, she had me down as with depression, of course. June 8th, 2020. And then come September 4th, 2020, she's labeling me with fixed delusion, parasite infestation. Yeah, so 2020. Now, I haven't made the effort to go and put all of this in order, but the gist of this video right now is just to show you how much focus was put as the source of my problem being a mental health issue. Okay? Now, folks, the proof is in the pudding, okay? This stuff even affects your hair. Okay, this is where the parasite is. I'm telling you. Look how my hair sticks straight out like that. That is the parasite. It grows like that. This is what it does. I'm not kidding, folks. I'm not kidding. This is scary shit. Scary fucking shit. Okay? So anyway. Alright, so like I said, this is all randomly, but okay, so this is August. And this is with a Jennifer Phillips, or is it still Baxter? I think this is she does neurotic disorders. Huh. Wow. Okay. I guess this is a third-party communication consult. Okay, let me see here. So, it says here, problem in lung, head, face, thinks there's a worm on face. Feel it in my head and feels it on my right lung. It is not a sensation. Wants to come in to have us look at lungs and ears and skin. Has appointment with family doctor in 7 days. We'll leave this with Dr. Baxter. That was my family doctor. Upset as tests were negative, so we are not looking hard enough for it, and she has done her research, so she is sure it is there. This teleconference was conducted at a time when our healthcare system was dealing with the COVID-19 pandemic, social distancing, blah, blah, blah. Okay. Assessment note. Follow-up app with her family doctor. Query cocaine-induced delusions of parasites? Question mark. I did not get a chance to ask her if she had tried cocaine. Chart review shows depression and daughter suicide. Could this be needing psychiatric help? She did not seem to be danger to herself or to others at this point. We'll leave it up to her GP to decide if this is formable. We'll contact Dr. Baxter today. Wow. I just wanted help getting this fucking shit out of me. That's all. Okay, hold on. Here we go. So this is Christina Thompson. Somebody else I saw. So this is what she had to say. Assessment note, delusional, very agitated on the phone, often yelling, irritated sounded, migraine, delusional parasitosis, headache, DDDX, migraine, tension headache, low likelihood malignancy, suspect delusional parasitosis is likely most responsible etiology. Reasonable to get CT head as baseline as she has not had this in the past. No red flags, although this was a difficult history. And then last ID referral indicates she's been referred to Dr. David Harris. Delusional parasitosis is a pre-contemplative to this diagnosis at this time. Advised patient she can contact clinic manager regarding obtaining old records. Behavioral concerns. PT required repeat reminders on phone to not yell and to speak respectfully. I reminded her that this is not acceptable behavior and will not be tolerated. She was accepting of this. Do you see their angle? They were wrong. Dead fucking wrong. Wrong. Yeah, I'm angry. Yeah, I'm emotional. 10 years later of this, if you knew the torment I go through, this thing in my legs, wrapping around my legs, it pulls me out of my sleep now. Think of your childhood. Think of growing pains in your legs. And then magnify it, intensify it, and make it go on for hours and hours. That's me, folks. That's where I'm at now with this shit. Yeah, take a look at my legs that I posted a picture of on X. Magnify it. Really look at it. You think I'm going to go on here and get all, make all this shit up for attention? I'd rather not. I don't really want to be known as Worm Girl. I'm actually the lead singer of the band Holy Grace. I'd like to put that out there. That's another piece of my life, puzzle of my life. Okay? Thank God for that, because it's really helped me and pulled me through. But more on that later. Yeah, so let's keep going here. I got plenty. Here we go. Here, I want to point out a straight out lie on this one here. Yeah. When I first came down, okay, what happened in the first experience is, I got to stop this video and then I'm going to continue on with another video. I just don't want them to be too long. Okay? See you soon.